Routine semen analysis. Male reproductive tract. Seminiferous tubules. Sperm production 5%. Epididymis. Sperm maturation. Seminal vesicles. Fluid with fructose 65%. Prostate gland. Fluid with proteases and acid. Functions as a propeller 25%. Bulbourethral gland. Alkaline mucus 5%. Germinal epithelium of the testis. Basal lamina. Blood testis barrier. Spermatogonia. Spermatocyte. Spermatocyte. Spermatid. Mature spermatid. And free sperms. Sperm anatomy. Genetic material in the head. Head size 5 to 6 micrometers long by 2.5 to 3 micrometers wide. Acrosome. Contains digestive enzymes like hyaluronidase and acrosin to break membrane of ovum. Semen is a biohazard. It contains many pathogens such as viruses and bacteria listed here. Therefore, wear gloves and laboratory coat. Wash hands. Disinfect after a test or a spill. Discard waste according to protocol. Semen collection guidelines for patients. These guidelines should be given to the patient to read before collection or read to the patient. They should be translated to patient's language. Semen analysis timeline. Collection. Place in incubator. Liquefaction. Assessment of several parameters. Microbiology. And stain for morphology assessment. Routine semen analysis. 1. Macroscopic. 2. Motility. 3. Count. 4. Morphology. 5. Round cells. 6. Microbiology. And 7. Fructose. Macroscopic examination includes appearance, volume, liquefaction, viscosity, and pH. Pre-warm materials and equipment. If laboratory temperature is not controlled, standardize test environment to 37 by putting all disposables and materials in the incubator. Volume by weight. Wake up before and after collection. Take the difference between the two weights. As semen density is almost 1 gram per ml, and based on volume equals density times weight, the difference between the two weights is considered the volume. It's considered more accurate than direct methods such as cylinder method, Pasteur pipette method, and syringe method. In direct methods, 0.3 to 0.9 ml of volume is lost. Volume, range and clinical significance. Normal range is considered between 1.5 to 5 ml, with a range of 0.1 to 11 ml. Hyperspermia, high volume, can be caused by prostatic infection, sex-boosting devices, drugs, treatments and surgeries, consumption of steroids, long abstinence, or high-protein diet. Low-volume hypospermia or aspermia, zero volume, can be caused by obstruction, CBAVD, poor development of seminal vesicles, collection problems, retrograde ejaculation, and testosterone deficiency. Liquefaction time. Normal range, less than 30 minutes, maximum 60 minutes. Never proceed with any test prior to complete liquefaction. Normally liquefied semen may still have jelly-like granules. Ignore them. If liquefaction time is more than 60 minutes, liquefy mechanically or chemically. Forced liquefaction. If culture is requested, do it now, before forced liquefaction. Microbiology, culture. See microbiology part. Directly after liquefaction, but before forced liquefaction. Appearance. After complete liquefaction, open cover and record color of semen. Normal, gray-white color, opaque translucent appearance, musty odor, chlorine-like. less opaque degree of clarity due to very low sperm count. Turbid, increased leukocytes, infection, pyospermia, dew culture. Yellow, due to jaundice, vitamins or drugs, or long abstinence, more than 10 days, or contamination with urine, which is toxic to sperms. Red-brown, increased erythrocytes, infection, hemospermia. Forced liquefaction. If liquefaction time more than 60 minutes, liquefy mechanically or chemically by enzymatic digestion. Pass semen 5 to 10 times in a syringe with 18 to 19 gauge needle to break coagulum. May damage spermatozoa and affects DNA integrity. Liquefy chemically by adding 1:1 volume of bromelain enzyme. Mix and incubate at 37 degrees centigrade for 10 minutes. Multiply count by 2. Changes biochemical markers and sperm motility. Viscosity. Normal, freely dripping, drop by drop. Viscous, long strings or drops. Highly viscous, continuous string, more than 2 centimeters long. Viscosity hinders sperm motility, count, antisperm, and biochemical markers. Causes: prostatic dysfunction, infection, and anti-sperm antibodies. pH determination. Mix sample well. Dip a pH paper in semen. Or add a drop of semen on pH paper using Pasteur pipette. Read within less than 30 seconds. Normal range alkaline, pH between 7.2 to 8. Low pH is caused by run of time, loss of CO2, infection, and this is of little clinical significance. High pH caused by ejaculatory duct obstruction, CBAVD, poor development of seminal vesicles, usually accompanied with low volume and low count. References: